Globally, as of August 2021, there have been about 200 million confirmed cases of COVID-19, including over 4 million deaths, reported to WHO. However, the vaccine disparity and inequity are being increased between high-income countries, HIC, and low and low-middle-income countries, LIC, LMIC. Furthermore, Delta variant is spreading rapidly among unvaccinated populations. WHO's goal is to support every country to vaccinate at least 10% of its population by September 2021, at least 40% by December 2021, and 70% by June 2022.
Vaccination is essential to preventing the spread and aggravation of COVID-19. But vaccination does not solve everything. As seen in the UK case, even if the vaccination rate is high, COVID-19 may re-emerge by emergence of a novel variant. The recently emerged COVID-19 variants have high transmission power compared to the existing ones, and the Delta variant has the highest transmission power with twice the reproduction index compared with the previous types. In a situation where herd immunity has not been achieved, the emergence or foreign import of a novel mutant can quickly cause a new surge in unvaccinated persons and even in vaccinated persons as breakthrough infection. So, surveillance for variant is very important after vaccination program started. For monitoring of variant, we should determine the method for variant detection, the ratio of analysis, and target for surveillance according to each country's laboratory resource.
Scientifically, the effort to develop the COVID-19 vaccine has been an overwhelming success, and combination of in-test testing, contact tracing, and vaccination is the cornerstone of the COVID-19 elimination strategy. When the COVID-19 vaccination program began in Korea, demand was high, but vaccines were in great short supply. So we had to start by vaccinating frontline healthcare workers and the elderly because these groups were at the highest risk of serious illness and death. Now we are confronting with more contagious Delta variant, and fourth wave of COVID-19 epidemic is ongoing now. However, the notable difference between the epidemic at the end of 2020 and the current epidemic is that the fatality rate continued to decrease, and in particular, the incidence of patients over the age of 60 who completed vaccination has rather decreased. As you can see in this figure, reported by Central Disease Control Headquarters, proportions of COVID-19 confirmed patients aggravating to become severe disease has decreased since April, maintaining the 2% range compared to last year. And the monthly fatality rate has been on a continuous decline since December 2020.
COVID-19 vaccines are safe, and getting vaccinated will help protect you against developing severe COVID-19 disease and dying from COVID-19. You may experience some mild side effects after getting vaccinated, which are signs that your body is building protection. About 2 weeks before the real vaccination, KDCA exercised a joint simulation of preparation 1 to 4 and vaccination 5 to 12, procedures as shown in the figure. One should be monitored at least 3 hours upon returning home and observed carefully for 3 days after vaccination. Then should visit again on the day of the next vaccination. All COVID-19 vaccines approved for emergency use listing by WHO has been thoroughly tested and proven to provide a high degree of protection against serious illness and death. As stronger virus variants emerge, it's important to take your vaccine when it's your turn. Vaccines offer strong protection, but that protection takes time to build. After being vaccinated, individuals should continue taking simple precautions, such as physical distancing, wearing a mask, keeping rooms well ventilated, avoiding crowds, cleaning hands, and coughing into a bent elbow or tissue. Get tested if you are sick, even if you've been vaccinated. Check local advice where you live and work. Do it all.
As we are living through the global pandemic, our effort to strengthen the international cooperation is even more important than ever. The international cooperation could be our weapon against COVID-19. From the very beginning of the pandemic, The international community has been focusing its support in minimizing the negative impacts caused by the virus. WHO proposed that the wealthy nations should actively contribute to COVAX, supporting developing countries to gain access to the vaccine. Korean government has also joined the global effort, making an earlier pledge of $10 million to COVAX. As Korea's leading development cooperation agency, KOICA has come up with the ABC program. The ABC program stands for the Agenda for Building Resilience Against COVID-19 through Development Cooperation, and it has the slogan, Save Lives and Safe Livelihoods. Through the ABC program, KOICA addresses to the fragility in health systems and socioeconomic hardship faced by partner countries. Moreover, as a part of the ABC program, KOICA opened up the COVID-19 Information Hub portal. Within the Information Hub, a number of quality news and information regarding COVID-19 is offered. Please visit KOICA COVID-19 Information Hub portal at covid19.koica.go.kr for daily news, weekly WHO summaries, editorial articles, focus reports, and latest updates from partner countries. KOICA will be with you, and together we shall overcome the pandemic.